So today I have to go and see a doctor, and this is one of my least favorite things to do in Puerto Rico. And it's not because of the doctors, they're usually pretty good. It's because of the pain you have to go through to actually get to see a doctor. Found parking at the hospital, San Pablo in Bayamon. So let's go find this doctor and see how long it takes. Actually, that wasn't that bad. Ted found a back way into the hospital complex with fairly easy parking and total traffic avoidance, so that was better. And going to see the doctor, I was able to find his office. He didn't have that many people waiting. Maybe there were about 4 in front of me.
Y también, ¿cuál es el password de Wi-Fi?
Password of what?
Wi-Fi? Wi-Fi? Internet?
So I only had to wait about an hour and a half for my 10 o'clock appointment. So he saw me at around 11:30, and he spent a good half hour with me, which is one thing I really do like about the doctors here in Puerto Rico. They're not rushed. It's not like some 15-minute, hi, how are you, what's your problem, get out kind of thing. They actually spend time, which is wonderful. So for all my complaining up front, it wasn't that bad. Would totally recommend this doctor. And now I have to go get a bunch of tests done. So hopefully I can get them all done in Dorado. I just hope I don't have to come back to Bayamon. So I just had a mammogram done in Vega Alta, which is right next door to Dorado, and it went pretty well. I just walked in, didn't need an appointment, only had to wait about maybe 25 minutes or so, and the receptionist spoke English, thank goodness, a little bit. The radiologist didn't, but she was very nice, and we got by with my cave Spanish and a lot of hand motions. So, you know, it worked out, and it was completely covered by insurance, so that was good. So yesterday I went to see the internist, and he recommended that I go see a specialist. So I called the specialist office today to try and make an appointment. The receptionist puts me on hold for 38 minutes, never picks up the phone. This is so typical for Puerto Rico. I had to give up. I have things to do now. I can't just wait around on hold all day. Wow, that took 4 phone calls to get an appointment with the specialist. The first time I was on hold for 38 minutes, I had to give up. The second time, maybe I was on hold for less than a minute and they hung up. The third time, I was on hold for about 11 minutes and they hung up. And then the fourth time, I guess the receptionist finally decided to talk to me, and I was able to get the appointment done, thank goodness. But they can't see me for a month, and it's one of those offices where we open at 8 and you just come in and it's first come, first serve, which means this is gonna take all day. This is the reality of healthcare in Puerto Rico. Okay, so blood test, urine test, 24-hour urine test, check. Only $82 out of pocket. The receptionist spoke English. The phlebotomist didn't really, but she spoke enough. We got by. They were super nice. Oh, and it was only about an hour and a half wait. Bone density test, check. Actually, this only took an hour, which is pretty good by Puerto Rico standards. Google Maps knew where the place was, which was kind of a miracle. I got the last parking place in a full lot, so that was actually really good parking karma. And the receptionist didn't really speak English, but her associate next to her did, so we were able to get through it. Unfortunately, I learned that my insurance doesn't cover the test in this location. I made the executive decision to just go ahead and pay cash for it. It was only $90. And rather than, you know, waste more time trying to figure out where on the island my insurance is going to cover this, and then potentially having to waste another half a day going into San Juan or Bayamon. Despite my whining about the medical system here, sometimes it works, and the people almost universally are really nice. So the receptionists, even if they don't speak a lot of English, they really try. My cave Spanish and hand motions, we usually get through it. There's usually somebody in the office who speaks pretty good English, and so that always helps. And then the medical professionals that I meet, they seem competent and they're very nice, and so that's one of the really good things about being here. We pay probably about a little over $600 a month for the two of us for health insurance, which is a lot of money, but on the mainland it would be twice as much or more. So here on the island it's half price insurance. It's just a lot more hassle. It's just a ton more hassle, and that's the trade-off. Oh man, I hate that. I just recorded such a great little monologue about my health experience, and then it completely wasn't recorded. Ugh.